Hello and welcome. If you've clicked here, you've come to the right place to learn more about acute respiratory distress syndrome, also known as ARDS. Today, we'll explore what ARDS is, how it affects the lungs, and why understanding its underlying physiology is critical in clinical care. Under normal conditions, oxygen enters the lungs and travels into tiny air sacs called alveoli. These alveoli are surrounded by capillaries, allowing oxygen to diffuse into the bloodstream while carbon dioxide is removed. This process depends on a thin, intact alveolar capillary membrane and the presence of surfactant, which keeps the alveoli open and compliant. In ARDS, this normal system becomes severely disrupted. ARDS is typically triggered by conditions such as sepsis, pneumonia, trauma, or aspiration. These insults initiate a widespread inflammatory response in the lungs. This inflammation damages both the alveolar epithelium and the capillary endothelium, leading to increased permeability of the alveolar capillary barrier. As a result, protein-rich fluid leaks into the alveoli, impairing gas exchange and causing severe hypoxemia. At the same time, surfactant is lost, leading to alveolar collapse and decreased lung compliance. The combination of fluid-filled alveoli, inflammation, and collapse creates significant ventilation perfusion mismatch and shunting. Clinically, patients with ARDS often present with rapid onset of difficulty breathing, low oxygen levels that are difficult to correct, and diffuse bilateral infiltrates seen on imaging. Diagnosis is based on the Berlin criteria, which include acute onset, bilateral opacities on imaging, respiratory failure not explained by cardiac causes, and impaired oxygenation measured by the PO2 to FiO2 ratio. Understanding the physiological mechanisms behind ARDS is essential for recognizing its severity and guiding appropriate clinical care.